ever since we started 8 West, we have become very familiar with the weight loss programs at St. Mary's Healthcare.
Today, we're introducing you to another member of that expert team, Dr. Brian Gluck with Mercy Health Partners in Muskegon. Both hospitals are part of Mercy Health.
And with him today is Shannon Jansma, a physician assistant, and this really gives us a chance to talk about some programs that are being offered along the lakeshore. So thank you both very much for being here with us today.
Thank you for having us.
Dr. Gluck, why don't you just start by outlining the services that you offer, because it really is a full-service opportunity for patients who are really struggling with weight loss.
Sure. What we know is weight loss surgery is the only method that someone could keep off their weight permanently. Medical weight management programs don't seem to work as well. And we established a bariatric surgery program 10 years ago with the help of Mercy Health. And to date, we have performed over 3,000 surgeries.
That's incredible.
Changing a lot of lives, yeah. So you have a lot of different services, and you brought some, actually, visuals, which always help for people to understand what can be sometimes a complicated process.
We like 3 procedures. The gold standard is the gastric bypass procedure, and we also perform the sleeve gastrectomy as well as the new gastric plication, which I think I'm the only one in Michigan performing that. What the sleeve gastrectomy, what that looks like, this is the stomach. We change the stomach into a ½ ounce pouch. It's about the size of the thumb.
Wow. Okay.
I cut the intestine in half as it comes out, bring up the furthest portion to drain that pouch, and reconnect you back down to the digestive enzymes. So you have this small restricted pouch, limb of intestine here where nothing gets absorbed. Digestive enzymes come in, things get absorbed. So this is the gold standard procedure. This has been performed since the late 60s and laparoscopically since 1994. Another procedure we perform, and that's been around about 10 years, is a sleeve gastrectomy. And what we do with that is, again, if this is a stomach, when patient's asleep, anesthesia will put a tube down the stomach for measurement. And we will create a sleeve of stomach along that tube. That tube, again, is just for measurement. And so what you have is a sleeve of stomach.
Okay.
This part of the stomach goes to pathology, goes into garbage.
Okay.
Wow.
So purely restricted.
By doing that, it makes people feel fuller faster, so they just don't eat as much. Is that the concept?
Exactly. People will feel fuller. People will be more satisfied. There is a hormone in this part of the stomach called ghrelin, appetite-stimulating hormone. We remove that hormone, and people don't feel hungry, partly because of that.
Okay.
So, and that is a hormone that also, when you diet, this hormone, this ghrelin, keeps increasing and increasing. So people who are on medical weight management diets, as their hormone increases, they stimulate the appetite. Finally, they say, forget this diet, I'm going to eat.
Okay.
Well, that's a hormone that doesn't go back down to normal until when you diet, you lose 20 pounds, and ghrelin levels don't go back down to normal until you've gained 25 pounds back.
Oh, okay.
Yeah, interesting.
That's why the yo-yo effect is so prevalent.
That's why the yo-yo effect, exactly.
So Shannon, what are some of the results that people see after something like this?
Well, we have reduction in comorbid conditions such as diabetes, hypercholesterolemia, hypertension. We have just lifestyle improvements and overall celebrations that we have with patients, being able to paint their toenails for the first time, being able to ride roller coasters with their grandchildren. We even had a patient that was couldn't get on a kidney transplant list until he lost weight, so he had the surgery, got on transplant list, and got a transplant. So there's lots of medical celebrations and just personal celebrations for patients that they really, the weight loss just
changes
their lives. Yeah, it's really cool to watch.
And Dr. Gluck, I know the surgery, of course, is just so important, your expertise in having done more than 3,000 of these since you started doing these procedures in Muskegon. But tell me about the whole, basically the whole program that people go through, because it's not just surgical, it is support, it is follow-up, it's changing those dietary habits.
Exactly, and I think that that probably separates our program from other programs in that we have the aftercare, and we encourage patients to come to the aftercare. And after doing 3,000 of these, what I know is if a patient doesn't get lifestyle, if they don't get it in their head, this isn't going to work. It doesn't matter what procedure we do for you. It's about lifestyle changes, and that's what I think we do well. We teach people how to make those lifestyle changes. So the surgery helps, and people can continue to make those lifestyle changes along with the surgery.
That's wonderful. And you have an opportunity actually coming up on May 10th about a seminar for those that are watching or know someone who might be interested in learning more about what's out there.
Yes,
Tell us about what people could expect if they attend this seminar.
Well, at the seminar, we give you an overview of the program. You hear from every one of our team members, and it's about a 2.5, 3 hour seminar. It's held at Mercy Hospital in Muskegon, and you know, it's free to anybody who signs up for it. And if you want to go further with the program, there's opportunity for consultations with me afterward.
Well, thank you so much for being here, and we also want to let folks know you have a great partner in the Grand Rapids area, that's St. Mary's Healthcare Systems, and of course they also have a couple of seminars coming up for folks in and around the Grand Rapids area also in May, and we'll have that information on our website at woodtv.com.
Thank
so
you.
fascinating, such promising results for people.
Thank you.
Thanks.
We'll be right back.
This is 8 West.